check at the veterinary clinic, your cat will have its eyes examined. A vet will look for any signs of injury, infection and disease. It is therefore a good idea to practice at home the type of handling a vet will use, so that your cat is fully comfortable with it. This will allow you to be able to check basic eye health at home, but also help to make this type of handling more familiar, so your cat is able to cope with it at the veterinary clinic. This handling is best done with your cat either facing away from you or positioning yourself side onto your cat to be as least threatening as possible. Such handling should always occur at a time when your cat is relaxed, for example resting in a bed or on your lap. Such handling involves gently parting both the upper and lower eyelid with index finger and thumb or 2 fingers to reveal as much of the eye as is comfortable for your cat. To help make the touching enjoyable, use a reward. Some cats enjoy being stroked, so gentle stroking can be used as a reward. A cat will learn best if the handling occurs first and then the reward follows. A small overlap between handling and reward is fine initially, as long as the handling always occurs first. Using this method, your cat learns that the handling predicts a reward, and thus the handling may become rewarding in its own right. A marker word or sound can be used to help your cat understand which behaviour leads to the reward. Here a clicker is used. First, the clicker is associated with the reward, food in this example. This can be achieved by simply making the sound and providing a reward immediately afterwards. Repeating this pairing of a word or sound with the reward over several times will teach your cat that the word or sound predicts a reward is on its way. We can then use the word or sound to let your cat know the behaviour it was performing was what we desired and a reward is on its way. It is usually obvious when your cat understands that the sound means a reward, as it will turn or look towards you and anticipate the reward. Handling should always remain within the boundaries of what a cat is comfortable with. Thus, handling should start with the most tolerated form, which may be a simple touch of the area above or below the eye. There are many stages of handling, and each should be practiced separately, but in a progressive manner. For example, making sure the cat is fully comfortable with having a single finger touch above or below the eye, and moving towards touching both above and below the eye at the same time, and continuing to be able to gently pull back the skin to reveal more of the eye. Work slowly and progressively all of the time, stopping between short bouts of handling to offer rewards for remaining relaxed and still. Initially, handling should be brief, and as your cat learns that the handling is associated with rewards, the length of time that your cat is handled can be gradually increased. How quickly handling progresses depends very much on the individual cat, so always be guided by your cat's body language and how comfortable it appears to be. If at any stage a cat struggles or appears uncomfortable in any manner, the handling should stop immediately and the cat be given a break. Cats may also need medicine placed into their eyes. Ensuring cats are fully comfortable having their eyes examined with no medication in sight will make this job much easier. The next step is to make sure your cat is fully comfortable with the medicine bottle approaching their eye. You can practice this at home with any bottle that is similar to a medicine bottle, for example gently touching it on the skin close to the eye, removing and rewarding. Practicing this and ensuring your cat is fully comfortable with it will mean that when your cat actually does need treatment, the only sensations that will be new will be the feeling of the medicine on the surface of the eye. It is important never to practice putting any medicine into a cat's eyes. This should only ever be done when advised and prescribed by a vet. However, your cat will be much more equipped to cope with the application of eye medicine if it already comfortably tolerates all the handling steps that come before this sensation.